guys, follow me. We're going to Dr. Walensky's right now. I am going to get clear and brilliant, and I'm going to show you every step of the way from walking into her office and leaving. It's not scary, super easy. Come meet everybody. I'm about to get numbed for clear and brilliant. Not totally sure what it is, but Dr. Walensky said I am going to love it, so I'm so excited to show it to you guys. This is a look. I have never done this. I do Fraxel every year. I tried PRP and I didn't love it. It just made me dry, and then I stopped being dry after 10 days, and I didn't see a difference. Okay. I like the VI peel. Fraxel's like my baby.
Fraxel's like the best.
Fraxel's the best.
She's here! Welcome! A regular Clear and Brilliant treatment is only 4 to 6 passes, and I do like 12. So you're gonna get kind of equivalent to 2 to 3 Clear and Brilliant treatments in one shot. Amazing. Because your skin is fair and you can take it, and I don't wanna go wussy on you because I think
no, kill me. Okay, so we've been numbing for about 30 minutes. My face is very numb, but mostly I feel it in my lips because I've been talking so much, so some of the numbing cream has gone into my lips. So it feels like if you're ever drunk and you start slurring your words and you can't really feel your mouth saying the words, that's how it feels. But it doesn't hurt, numbing cream doesn't hurt, it just numbs you. It's like going to the dentist, you know?
So, we're ready to wipe off. Is it 30 minutes or 45 minutes or an hour? 40 minutes. 40, I think that's good. You can take 40 minutes.
I can take it.
I'm going to leave your neck on and start with your face, and then I'll wipe it off after.
Okay.
When we talk about trauma, we're talking about upsetting the collagen in the skin so that it boosts production, which is good because that is what causes the skin texture to look better, to have increased collagen production. Leads to the skin looking better. Pores, fine lines, overall skin health. I mean, when you get to a certain age, if you're gonna spend money on, I know you spend money on facials and stuff like that, that might make your skin look good for a week or so after, but long term.
This is really doing something.
Exactly. It just gives you 30 minutes per treatment card. There's a little card. And honestly, this is used at med spas and stuff like that. You can definitely get a good treatment from anyone. I don't think it's really a dangerous device, so it's fine. The difference that you'll find why to do it in a derm's office is if I'm doing it, I'm going to be aggressive because I can.
Right.
I don't want a technician in a med spa doing more than the standard. But I think to see something, you want to be doing a little more than what the machine, what they tell you. When you get a device, when you get a laser, when dermatologists and plastic surgeons or anyone med spa gets these devices, the reps tell you what the treatment settings are, but then you have to figure it out yourself. For something, if you're going to be risking and going more aggressive than the standard of care, yes. But that's also sometimes how you see the results is by getting more aggressive. So that's that, like getting a Groupon on a Clear and Brilliant. It's not that they might be using a Clear and Brilliant, but they might be sharing the 30 minutes amongst several people and only doing 4 passes. And so you might think you're saving money by spending $200, but maybe if you spent $450 in a derm's office for this treatment, you would be getting the equivalent of 3 of those treatments.
And how much is this usually?
We charge for a package of 3. It comes out to being, I think it's around $400.
Oh, that's
if you buy a package,
Oh,
it's
wow.
very reasonable.
Oh, you guys, it's way less than I thought.
I usually don't do it. I have a physician assistant doing it, but she's a physician assistant. She's really, it's not a tech. It's somebody who also treats dermatologic problems. And Heather, we've met Heather,
Yeah. They know how.
And if someone requests me to do it, I will, but I prefer not to, just because you can see it's really not rocket science.
So
it's just more about the technique.
Is there a treatment that you prefer yourself to do? Like when you do
injectables, Fraxel, anything that has a little more risk, even PRP with microneedling.
You'll do it.
This is, if you see, like you just press a button and you go, but you can mess this up too. You're having to treat not right on the same skin over and over again. You can definitely cause a burn if you're too much on the same spot for too long. So it's not like it's not without risk. It's pretty babyish for me to
This
have
is
to
not
worry about.
painful, just so everyone knows.
Some
I really
people
don't
squirm.
feel it.
It's really weird. I don't know why. I love this treatment. I want to do it all the time. I just don't have time. But if I did have more time, I would do this all the time. And that's why I wondered if you would like it. Since you like facials, I'm wondering if you should stop doing that and do this instead.
Oh, I mean, I will.
Like I have a lot of patients that spend money on facials and then they'll say, should I do a hydrofacial, which we do here in the office, which is extractions and microdermabrasion, which is different. What that's doing is it's just taking the top layer of skin off.
Right.
You're not getting any collagen production. I don't care what they say. I know they say it's anti-aging, but it's not.
Yeah, totally.
Here, we're doing something. We're actually stimulating collagen, and it's punching tiny little microthermal zones just like Fraxel does, just on a much lighter level. So it's safe for much darker skin types as well, which is a huge pro of this too. I would do this on someone who's African American. I probably wouldn't do
Good to
a
know.
full Fraxel on someone with dark skin.
Right, I was telling them because you can
There's
flare.
risk of pigmenting, and also there's risk of melasma flaring. This is much safer. And I also have patients, I just had somebody ask me this, she's like, I want to come every month and just do stuff, not to look puffy and like a monster with fillers, but just to kind of keep her skin going.
I like
because
that,
it's like her happy place here.
I
And
love that.
there's, it's kind of nice to offer different things and see what people like. Some people like this, some people don't like this.
Yeah.
Some people like microneedling, some people love Fraxel. I mean, it kind of just depends on the person and what they're. But Fraxel, you need to plan for downtime. This you don't.
Oh, now it's getting hot.
Yes, that's right. After a few passes, you start to feel it. Just tell me when you can't take it anymore and we'll go to your neck. And you can do the back of the hands, you can do the neck, I've done the chest a lot. It's a nice light treatment for anywhere. It just depends on what you
It
want to do.
feels similar to Fraxel to me.
It is Fraxel. It's actually almost the same wavelength as the Fraxel. It's just much lighter. So it's not punching as many little thermal dots in your skin as Fraxel.
And what is my aftercare for this?
Sunscreen, moisturizer.
Wash my face as normal tonight. No retinol.
Yeah, I wouldn't for a couple of days. But actually, even right after sometimes, you don't have any of your product on you, right?
I have nothing on.
Okay.
So this is punching holes in my skin.
Tiny little holes that are creating trauma to the collagen. I guess I should use a different word than trauma because that sounds negative, but it's a positive. It's it's upsetting the collagen so that the collagen will make more.
Well, let me ask you, I get asked every day about Halo and BBL.
Okay, so Halo is very similar to Fraxel. I don't know that it's really better or worse. It just depends on the dermatologist or plastic surgeon settings or med spa settings, because you can be more or less aggressive. It's not like this where it's kind of one size fits all. Although this also, I have it on 3 dots, and if you're on 1 dot, you're going to get a wussy treatment. So there is a little bit of something to this, but it's not the same like Halo and Fraxel. You really need to know the settings. And I've heard some patients like Halo more, some people like it less. I think, again, it really depends on the dermatologist who's choosing the settings. BBL, I think, is similar to IPL. It's for brown spots.
I keep thinking it's a Brazilian butt.
Yeah, I know. I think people do say BBL for a Brazilian butt.
Yeah.
But there is something, it's kind of old now. I don't know. I've heard about, those two I heard about a couple of years ago, and then I stopped hearing about them so much. They were kind of hot. I think that's...
And people are talking a lot about this Morpheus 8 as opposed to Ultherapy. What are your thoughts on that?
Yes, it's something I'm looking into. I do think that there's something to radiofrequency microneedling. I don't know yet which one's the best device. I need more time to ask friends. I have a friend who has secret radiofrequency, and she likes that. I've heard of plastic surgeons having Morpheus. The difference with Ulthera and those devices is that they require a series. It's not a one and done. Ulthera you do once and you're supposed to wait 3 months and see that you see a tightening result. With Morpheus, I believe it's more of a package of 3, and really it's hard to get people to commit to doing 3.
It really is, right?
I find it very hard, and actually a lot of people have told me that offices are doing Ulthera first, followed by a package of Morpheus. That was why I didn't get it, to be honest with you, because I was thinking, if I'm going to do, I can barely get people to do Ulthera. How am I going to get people to do Ulthera and Morpheus? It's just a lot of money. And again, we're not great at skin tightening ever. So is the result even going to be worth your money and pain?
Right.
So I don't think it's as amazing as it seems just yet.
Do you think Ultherapy is the best thing there is for
right now,
skin neck laxity? Like,
I think right now it's that or Morpheus. I don't think Morpheus is so much better. I think there are some newer things on the market I'm hearing about that I'm going to wait and see if they're really good.
Can you say what they're called?
Something called Tixel, someone just told me about. Tixel?
For skin tightening?
Yes, I'm just waiting to hear more about it from the person who purchased it in Texas.
But that wasn't painful. That was, I have no happy pills.
And we did like 12 or more passes.
Yeah, I'm totally
on it,
lucid
so
and I was not in pain.
that's equivalent to 2.5, 3 treatments at once. So we'll see how much time we have left. The time runs out. It's a timer, so we'll see how much time
that's
we have.
fascinating.
Yeah, it's kind of different.
Yeah.
I also like, people never want to do this, but they're always happy. I line the lips a little bit.
Oh, I love that.
Well, you like it because you want lips, but
Yeah.
a lot of people
don't want
like a 77-year-old woman is nervous. She's never done anything, and now she's got lip
She
fillers.
looks amazing.
But I did her vermilion, but the line of her lips, that helps a lot with the smoker's lines transition. And see, we're heating over the Bellatero in your neck, and it's totally fine. I wouldn't do this 2 weeks after filling. I would wait. That's kind of the only thing. Let's see if this hurts you. There's no numbing here to do. A couple pass on your chest. Look, you have no numbing here. Is that so
No,
uncomfortable?
do it. Do you want me to pose?
I see a little bit of crepiness starting
Yeah,
here.
it is. Why?
We only have
Just
13%
age?
left. Yeah, but this is a good treatment. People like this for this area because it's good prevention.
The crepiness. Oh.
Yeah, that's, you know what's good for that? Radias. There's
Filler?
I dilute filler with saline, and we put it in the chest.
All right, I might be on my way.
No, not yet. You're not ready yet. I'm not gonna let you do that yet. Some things we gotta save for your adulthood.
Save for
You're just a
save
baby.
for old age.
You're just a baby. Without numbing.
I don't feel it.
So maybe it dripped down a little. When I was sampling this device, I was like the first one to ever use this laser in our office.
Yeah.
And I did it without numbing because the rep said you don't need numbing. They first sold this that you don't need numbing. Oh, it was such a bad experience.
Really?
Yeah, I would not recommend that.
Oh, you absolutely need numbing. My
Yeah.
face was like fiery by the end, but honestly, this is not painful to me.
No, I find it fine too, but honestly, why suffer? There's no point in suffering if there's something that helps. That's the problem with Ulthera. There's not a lot that helps that pain.
I know.
Except for serious medications to kind of put you out, which I don't love. Done!
Wow.
So this tip goes away. This is disposable, this little tip here. That gets thrown out. This goes back in its cradle.
Okay.
We can unblind you.
I'm alive.
And I want everyone to see what you look like. I think it looks pretty
Hello
great.
world. How do I look? Am I beautiful?
This smells yummy, doesn't
I
it?
love this.
I know.
Is this your brand? What is this?
No, it's from the, I have this lady that I love who sells me things. This one's from Complex Skincare. I don't
What is
sell
this
it or
for?
anything. I use it for microneedling post-op. It's a post-procedural serum and it helps with healing. It's like instead of PRP. But I don't want to do a lot
Ooh,
on
it
your
smells
skin.
really good.
Yeah, that smells good. And now this is my favorite tinted sunscreen called Elements by Elta because it has hyaluronic
I
acid.
tell everybody to get Elta,
Don't
and
you love
Elta
it?
is your favorite.
It's the best
I have.
tint. I just tried a new sunscreen though that we might be making.
Really?
It's non-tinted. It's a little whitish because people ask me sometimes the tinted can be messy.
I don't
love
wear
it.
tinted.
This one's tinted. So you use the UV clear?
Yes. No, I use the white one and it doesn't make me white.
Which one is that? The UV clear, yeah.
Yeah, whatever you have
Yeah.
here in the sample
But
packets.
that one sometimes has a little bit of chemical
I don't
sunscreen,
mind
which not
it.
everyone likes.
I
So,
think chemical sunscreen looks best under my makeup.
that's definitely true. That's why I wanted to find a mineral only. I'm curious how this does with your melasma since it is still summertime.
We shall see.
But I know you're so careful. The reason I would do
I'm
this
so
on
careful.
you is because you're careful. I don't know that I would do this on
I'm beyond
somebody
careful.
with melasma middle of the summer. If not.
No, I'll be.
And I'm not putting any makeup on Jillian. I'm just doing sunscreen because I think I want you to see what it looks like without. Like you don't need a lot of makeup. Your skin just looks kind of glowy, even right away.
Ooh, I like.
It's glowy.
Very
right?
glowy.
Sorry, just rubbing it.
Oh
a
no,
little
it's
bit more.
perfect. Ooh, it's very glowy. It looks, you know what? It looks just like a way less Fraxel.
Fraxel, exactly. I think within 24 hours your skin starts to look really good. And remember, I did more aggressive than you would be
I think it's gonna
experiencing
be
with
great.
most other people, so you're not going to see this redness, probably, the severe redness, but we did, what's it
I
called?
can already
We probably
tell
did
my-
like 3 in 1.
And I can already tell my skin's gonna love this.
I think
Like,
so.
I can tell.
I'm curious. I'm curious what you think about it versus you've been doing like microneedling at that spa. and
No,
you
no,
love
I
it.
don't do microneedling. I do
What do you do?
microdermabrasion.
But like, I don't know that you, that's good
I don't
for,
need it. I haven't gone in a while. My skin looks so smooth.
I think you're gonna like
I'm
it.
gonna love it. I'm gonna be hooked.
I think it's worth putting money on that. If you're, so you're picking microneedling or this, or you're doing
I'm gonna
a
do that. I
massive
think I'm
Fraxel
gonna-
once a year.
I can tell I'm gonna like this.
Like this year I did 2 major Fraxels on for my pores and it was awesome,
Yeah.
but my skin looked bad for a little bit after
Yeah,
I
yeah.
broke out. This is nicer. If you have the time that you can come once a month and invest in like
Yeah.
3 to 6 of these, let's say, but 3 you'll see something. 1, your skin will look good,
Yeah.
but it will, you know what it will? It looks like the microdermabrasion for a little longer.
So when would I do this again?
A month.
In a month? That's
If
good.
you like
That's end
it,
of
let's
summer.
see. Let's see
I
if you
think
like
I'm
it.
gonna
And you
like
can
it.
do this throughout the summer. You don't have to worry about it. I went aggressive on you, but like if anyone I'm nervous about them and melasma and they're gonna be in the sun a lot, I might just not take it quite this high.
Yeah.
Yay!